Okay, good afternoon, everyone, and welcome to our live discussion today on our TH Facebook page. Welcome to all those who decided to join. This month is the month of August, and we are celebrating Children Health and Safety Month. Well, it's not really a celebration, but certainly we want to bring awareness to this topic. My name is Franka Mohammed, and I'll be the moderator for this evening's discussion. And today I have my colleague Sean Bridgelal, who is an optometrist at TH Optical with more than 6 years experience in primary eye care and also a lot of experience seeing with eye issues. So he and I are going to be chatting with our very special guest, Dr. Krystal Bharath, who is joining us on the call. A very warm welcome to Dr. Krystal Bharath, who is a pediatric and neuro-ophthalmology consultant with approximately 13 years experience in ophthalmology, treating a variety of clinical diseases across our RHAs and also at her private practice in Chaguanas. Dr. Bharath is UK trained, completing her fellowship at the University Hospitals of Leicester. She's a member of the Ophthalmological Society of Trinidad and Tobago, the Ophthalmological Society of the West Indies, the American Academy of Ophthalmology, and the European Society of Neuro-Ophthalmologists. In previous years, she served as the Secretary for Ophthalmological Society of Trinidad and Tobago. She loves working with children and is passionate about patient education, which is why we are so happy to have her on the call. So welcome, Dr. Bharath, welcome, Sean, and thank you for joining our discussion. So let's jump right in. This is a very, very interesting topic because, back to school is right around the corner in the month of August, and, parents may need some guidance on what to look for when their children, when they suspect that something may be wrong with their vision. So my first question really is to Sean, Mr. Bridgelal. I was wondering, could you tell us a little bit about what you notice in your clinics when children present with undiagnosed vision issues for quite some time? Like, what does that look like in terms of how does it affect their learning or their behavior or their school experience? Could you share some of that with us?
Well, lots of times the children tend to have like a slower rate of learning, and it is not really because that they are slow as children, is because they don't have the stimulus. So you find that the reading is a bit slower, their attention a bit all over the place because they can't focus, so they find a way to entertain themselves. And the coordination and the confidence itself is often a bit reduced. So a lot of times you would write these children off as a learning delay or bad behavior or something around that. But many a time when we do give the correction, whether it's glasses or contact lenses, you see a total shift in personalities. They may become more confident, outgoing, more coordinated. So it's a good thing to see.
Wow. Okay. Thank you. I mean, it sounds so simple, but we don't always connect it to vision issues when children act out in a classroom setting. So that's something very common, maybe that people in primary eye care would notice.
Hmm.
But now that we have Dr. Bharath on the call, and thank you again for joining us, Dr. Bharath, could you tell us what has been your experience when you see these patients presenting? With parents complaining of bad behavior at school. Or what's been your experience?
Certainly. So I would like to agree with Sean, first of all, to say that when children have some sort of visual impairment, it puts the child at a disadvantage. And I agree that with a lot of things that he just said, in that that child may be labeled as being naughty, being unable to keep up with the tasks in school, having poor handwriting. They may even be reprimanded by us or as parents, or they may be reprimanded by their teacher then they lose confidence in their ability. So it's like a slippery slope with that. The other thing I would like to say as well with respect to behaviors, I would say that I see a lot of children that come in from the teacher or the parent noticing that the child has certain behaviors. And some of the behaviors that they exhibit would be that in school, the teacher notices that the child might be squinting, they might be holding things close to their face, they might be going close up to their book, they may be writing with their head on the table. So all of these things kind of start happening, and sometimes parents come in noticing and seeing them skipping letters and that kind of thing, and that might clue us into, what that something might be wrong. Not just in terms of glasses, but just in terms of visual impairment in the child on the whole.
Yes, wow. That really is something I remember seeing at school as well, seeing children putting their head on the desk. And, you wouldn't really think much of it unless you really get the knowledge that these things should be checked. So thank you. I know you would probably perform like multiple tests, and you're treating patients after you diagnose what might be underlying. Could you tell us about what are some of the top threats to children's eye health? Like what are the most serious or common issues that you do really see? If you could share some more information on that.
Sure. So the top, one of the common things, and I'm sure Sean sees this a lot as an optometrist as well, is refractive errors. And the other things that we tend to see, and sorry, let me just backtrack a bit. When I say refractive error, what does that mean? So refraction or refractive error is what we say as as doctors and optometrists in this field. What we mean is that the child has need for glasses, simply put, and that's quite common. One of the other things I tend to see a lot is children coming in for referrals with lazy eye. Both the parents might term lazy eye, or the someone in the community or even one of the healthcare providers might send the patient forward with lazy eye. And what is lazy eye? So lazy eye, the scientific word for it is called amblyopia. And we confuse sometimes lazy eye with someone who has a turn in their eye or a cross eye. And that's another thing that I see. But lazy eye actually means that the patient, not that their eyes are crossed, but that the patient has poor vision in one eye. And that might have been going on for some time, and it might be something that might be able to be treated. The third thing I alluded to it just now, when I said cross eyes, we know it in our community as hokey eye, right? And so our patients who have crossed eyes, pokey eyes, we also call it squints, or turns in the patient's eyes. They all refer to the same things. And a child that does not have an eye that is central, and one or both eyes turned any which way, that is not the usual center fixation. So it could be up, down, in, out, turned, these patients can have eye pathology. And that's another important point whilst we're on this, to say that children with turns in their eyes or pokey eye, sometimes we say maybe they're born that way. And some people say they grow out of it. And I do have a lot of patients coming in after many years thinking that, okay, we've given it 3 to 4 years, it's still there. Please don't think that every single situation is going to get better over time. Please don't think that it is just how they're born, and there might not be an underlying issue, because some of the time they might have some eye disease. They might have something that needs treatment. They might have something going on in the brain that might need to be addressed. And it may also be glasses, right? Or poor vision that is causing the turn in the eye. So the lazy eye, the cross eyes, the need for glasses, those are like the top three. And then I would say we even have rarer things like cataracts in children and glaucoma in children. And the thing is, it might sound, absolutely out of this world to a lot of us that children could have cataract. We thought that that only happens as people age, right? You expect over a certain age, right? Right, Sean? And but kids do have cataracts. They can be born with this. It doesn't have to come over time. There are many different causes, of course, which we won't get into. But just to let you know that that's also something we might see in the clinics as well.
Wow, that's quite a range, I really
Yes,
think,
yeah.
it's really not as simple as it might look. And it's really good for parents to know they should investigate, they should visit the doctor, the optometrist. That's really good advice. So Sean, to you, I mean, can you relate to what Dr. Bharath is saying? Like, is your experience much different or similar? What are you seeing as the top three things presenting in optometrist clinics?
Yeah, is pretty similar. At the top of the list, I would have to say refractive errors, um, especially since COVID. So a lot of the children, they come in as myopic, short-sighted basically. They expose a lot more near work, a lot more screen time, less activities outside, and exposure to the sunlight itself, which is good for the eyes. Another thing that I'd like to reiterate that Dr. Barrett said is the education aspect too, because I would say at least 80% of my amblyopia patients or strabismus patients, they were told that they would grow out of it. And that's not the case because there's a critical developmental period that you have to act within. So it's very important that we educate everyone and we get the treatment when it is specifically needed because after a certain period is very low results. All right. Well, the other things that we'll tend to come across too is eye strain from the excessive screen use. So going back again with that extra screen use from COVID that we seem to pick up as a habit, and you want to really try and reduce that. So, and of course, from there we'll have different things called like undiagnosed focusing or tracking issues, whether it's weaknesses of the eye muscles where they can't converge well to see at near or to see in the distance or switch between them. So it's a lot more going on than just glasses itself. It's called primary eye care because we try to suss out all these things in the beginning. And then, of course, we refer across to our colleagues like Dr. Barrett, and then we have that full eye care going on. So it's a lot to look out for.
Yes, it
Yeah.
is. I mean, I have a daughter too, so now I think, oh my God, like we need to really keep this regular eye testing going because you just never know what's going on unless you visit the eye care professionals. So very, very informative so far. That just reminds me that a lot of people viewing right now, y'all actually may have questions. And I want to encourage you to post those questions in the comments. And we will really try to answer those questions as we go along. Okay, very interesting discussion so far. So let me go back to Dr. Bharat now. Is there anything you would like to recommend that parents could do at home? Any at-home tests that can be used on very young children or toddlers because they may suspect, but they're not really sure if they have to rush to the optometrist or the ophthalmologist. Is there any guideline you could provide that might guide at home?
Yeah, absolutely. So when we think about children and eye care in children, we think about the older kids and then the really young ones. So first I'll address the really young children because that's where it becomes very difficult as parents to know. So from the time that a child is born, their eyes go through and continue to go through a period of development, right? The visual system is developing, in children all the time, up to that critical point of 7 or 8 years old. And in that first 3 months or 4 months of your baby being born, you expect certain things. So you expect that at first you're not sure if they're looking at you. They may look somewhat inattentive. But then as time goes by, as they're nearing their 3 to 4 month stage, you should start seeing them focusing more on your face in particular. They should start being able to follow a toy or a target across a midline, but children love their parents' faces, right? So it's a quick, easy test just to make sure your child, you move around, you look and see if they are able to see, to move the eye and track your face or an object. That's the first thing. The second thing is, I would say for breastfeeding moms, your child looks up at you. So feeding, especially breastfeeding moms, you will see that child looking at you. And then the other things is they would smile responsively as well. That's something that starts happening very early on. So that's a really young children. And then beyond the 4 month mark, I would say there are other kinds of clues. So if you are noticing a turn or they're not focusing at that point, then definitely bring them into the ophthalmologist. Then the other things I would say is beyond that age, they start picking up things, so first they grasp an object with their entire hands. It's called the palmar grasp. And then they grasp objects more fine with a pincer grasp, so between their index finger and thumb. So you look at how they're reaching for objects, if they're missing, if they seem inattentive, if their coordination is impaired, when they start mobilizing, if you're finding a delay in mobilization, getting up, and standing up and holding onto things, they're bumping into things while they're navigating. So these are older kids now, over 1 year old, 18 months, they're walking. You notice a lot of stumbling and so on. It might be visual. And I would also say for those kinds of kids that have also the mobilization problems, then they would seek the attention of their pediatrician as well, because that might be another issue that might be going on. But visual and motor and all these other developmental areas, they're linked. So sometimes, and that's another thing, sometimes you can start noticing something and it might have overlap with many different specialties. I would also say, and again, the parent is always right. If you notice as a parent something not looking just right with the eyes, the lids are closed or droopy, you feel that the eye is looking big or small, or one is looking different than the other. If you see any redness, if you see any sensitivity to light, they're squinting their eyes in bright light, all these things clue you in that something might be happening. Tearing as well of the eyes, excessive tearing. Frequent blinking, that's one I get a lot, right? All of these little things. So that's for the eye, and that's just generally in younger kids. Older children, the school-age children, would have the things we spoke about before, which is holding objects close to them, going close to things, squinting their eyes, that kind of thing. And so I would say those are basically things that come to mind.
Wow, such good information. I'm really glad we're doing this conversation because I think a lot of people, especially new mothers,
Yeah.
having children for the first time, they may let things pass, you just want to be happy, you don't want to be worried. But
Yes,
at the
yeah, you
same time, this is very, very important. So I really think, that's such good information shared. Actually, one of our viewers, Tasha Lee, she asked the question, can light sensitivity in infants affect eye health? And Dr. Bharath, I think you just mentioned that that is also one of the cues to look
yes,
for
yeah.
parents, because that may be an indicator of something underlying, right?
Correct. Yes, yeah.
So Sean, just to bring you back into the conversation, I know lots of similarities would occur in patients you may see in the clinics, in the optometry clinics, but is there anything you wanted to add to what Dr. Barrett said?
Uh, Basically, Dr. Bharath covered it, but I would just like to say that the eye testing at these different ages, they won't look the same as testing an adult, of course. So, for example, we have the Snellen chart when you test adults with the big E and the different letters and whatnot. For children, especially at these younger ages, we would do something called preferential looking. So we just basically put a shiny object or a calibrated object where the children could detect it. And it's not to say whether they could count how much lines on it, it's just that whether they grab for it or not. So as long as it's within their view and they could detect it, then they reach for it. And the tests are basically modified for these different critical developmental periods because you have certain cues to meet at certain ages. So that's basically all I had to add to it, and it's good to be tracking all these achievements as your kid grows up.
Wow.
Yeah,
Okay. So one eye test does not fit all then.
correct. Yeah.
Right. Okay. So that's also interesting because, I know children, young children would be unsettled and they might be afraid of the eye test too. So, parents would struggle with getting them to even sit down in the chair. So I could imagine that you would have to be very patient.
Yeah, sometimes you would have to modify the test to suit the child itself, but the end
Right.
result is always the same. So
Okay.
it's about being adaptable also.
Okay. Great. Next question I have now. Is about the risks. And this to Dr. Bharath. I mean, you mentioned pathology turning up in some of these patients, and like what I wanted to know, what are the risks? I mean, because we do want to establish some urgency when it comes to caring for vision in young children, and what are some of the risks of not addressing these issues early on?
So, one of the risks is something that we kind of went through before, but what happens is that there is a critical period of eye development, right? So that period starts from when the child is born and it continues on um, until the age of about 7 or 8. Well, that we use that as a rough guide, by which point whatever is causing the visual problem, if it is something that can be treated, is treated. Okay. Um, that being said, in my experience, I do have patients who, based on what it is, you still have a way beyond that, in certain cases to treat. But one of the main risks I would say is permanent visual loss. And I mean, this is a very broad question. So now we're not talking about just glasses or something like that. We're talking about even more serious things. So some more serious things might have even a shorter time frame in your mind. So I would say it is very difficult to give a rough estimate on the urgency, but I would say a young child with any visual symptoms or that we have discussed or gone through, or anything else or that is concerning to the parent or someone in the family, should be checked as soon as possible, because it's only when you get to your ophthalmologist then they can tell you, okay, this is something that is urgent, or this is nothing to worry about. It's very difficult for us. And I'll share a story with you. Um, my son, when I had my son, and he was very little, which he isn't anymore. He at 3 months old, I noticed that he wasn't fixating on me, and he wasn't really looking. And sometimes he would look, and I don't know if it's because I'm an eye doctor, and at that time I wasn't a pediatric ophthalmologist, I was just a general ophthalmologist. But I noticed at times he wasn't looking at me, and it was really scary because I started to imagine maybe something is wrong. So I gave it 2 weeks. And then he was 3.5 months, and he was still not focusing. So I took him to see someone, and everything was checked, and he was absolutely normal. And actually 2 weeks later, which was his 4 month mark, he became very focused and very attentive. But even me, I took my son in a very short time, and because I know of the importance, and that's what we want to tell our parents tonight. that as parents we just have to trust ourselves sometimes, and we see something wrong, and I went and it was nothing, and maybe that'll be the case when you bring your child in too. But it is very important just to say that permanent visual loss can happen if something isn't attended to straight away. And we have a window, we have a time frame, to step up things and to do different treatments. So I think just as soon as possible would be the way that I would answer that. And then the other sort of areas that would be affected by permanent visual loss or child with reduced vision, which Sean had said as well in his explanation, was that the child could have academic performance issues and social performance issues as well. So those are other issues that arise from a child not getting early intervention. So we have children who are 13 or 12, and now they've been kept back a few years and are doing SE at a later age because they had a really strong glasses prescription and it kept them back. And actually, they're quite frustrated, that particular child I'm thinking about, because it just wasn't dealt with in a timely manner. And one of the eyes is a bit reduced, both of them generally, but one of them in particular as compared to the other. So soon as possible. Soon as possible.
Oh gosh, thank you. And thanks for sharing your personal experience too, because a lot of parents might be thinking they want to check, but they're afraid to check.
Yeah,
They
yeah,
think they don't
yeah.
want to get bad news, but you can also get good news, like you rightly
Good
said.
news, yeah, good news as well is possible.
Exactly. Exactly. So I saw we had one other question coming in from Sunil. And I guess I could address this one to Sean. They are asking, why is astigmatism so common? So I don't know if that's just a broad question in general or in children. Can you relate that question specifically to children?
Uh, I'll do it for both. So basically, astigmatism is just the uneven surface of the cornea itself. So rarely in nature we have something that is completely symmetrical or smooth. So some amount of astigmatism is fine. Most of us have it. We just don't notice. In children, in particular, in people, there's two things more commonly causing it as the progression of your genetics as well as a manual disturbance of the cornea itself. And really that's just rubbing the eyes a lot. So children may be prone to allergies, whether it's dust or pet hair or anything like that. Sometimes if the child isn't getting that visual stimulus, uh, whether they need glasses or not, they'll attempt to stimulate the retina there. So they rub the eyes and then they get those little flashes and they entertained. So they keep doing that and the astigmatism keeps going up. So it seems to be a common thing these days, but it's something that education and awareness would bring light to. So if you do find your child rubbing the eyes a lot, uh, it's good to get that addressed because it could be increasing the prescription.
Okay, very interested. Simple thing like rubbing your eyes. Oh, if I
Correct.
can do that.
Or that.
Well, I mean, really interesting discussion. I mean, I have a question to Dr. Bharath, and I know we're getting close to the end of our talk, but as you talked about eye development at different stages in very young children, from birth to the age of 7 and beyond that, some patients I know, those that are born prematurely, babies, they have a risk of their retina not fully developing or being at risk. I mean, like, is there any message, particularly to parents of premature baby, and to advise on what is the guideline? Because some patients I know they would be in the hospital. Some babies are born in the hospital, but then some babies are born in private care. So there's no one standard um, route of care in those situations. So, like, what would be your advice to parents of premature baby?
Right. So I would defer to the guidelines, the guidelines that we use. One of the guidelines that we use. And basically it says that any child that is born underneath, let's say less than um 31 weeks and 6 days. So to put that simply, any child that is born less than or under 32 weeks, it is probably a good idea. Well, no, under 32 weeks and by birth weight as well, so less than 1,495 grams. I know it's not in pounds, but 1,495 grams. If you kind of stick those two values in your mind, 32 weeks, and I'll round it up, so I'll say 1,500 grams. So a lighter baby or earlier baby born a bit younger, every baby should have, a retinal screening exam. And in the hospitals, that's more or less carried out. And also those guidelines I gave were like the older guidelines. There are newer guidelines which actually start from a slightly younger age. So it says that children 31 weeks and less should get screened. But I think in our population, to play it safe, you can even go back up to the 32 weeks and under, and anything under 1,500 grams, or 1.5 kg. So any child as well, if you have a baby that was born that had to have neonatal care in hospital, ended up in the neonatal ICU, if the child has not had a retinal screening exam, then that is something that absolutely must be done. And it would more or less be done through the hospitals. But you raised an important point, which is that sometimes, kids are born everywhere else. And the reason for that, as you rightfully said, is there could be severe blinding retinal disease in some cases. And this is preventable. And I want to say here that in the Vision 2020 initiative, right, WHO, which is the World Health Organization, had estimated that 19 million children worldwide had visual impairments, right? 19 million. And half of that was avoidable or preventable, right? So retinal disease in a premature child, it is and should be prevented at all costs. So thanks for that question. Obviously, a lot of patients with premature babies have a lot of other reviews that they have to do, and they've been through a lot, as well as parents with a child that's premature that requires a bit more. So there's a level of prematurity we would worry a bit more about in eyes. So please keep those values in mind. 32 weeks, I would say, just to play it safe, and any child less than 1,500 grams. Of course, there are different specifics and details, but I mean, just for general knowledge, we could probably use those guidelines.
Okay, thank you so much for that guidance, because I know it may be something that not every parent would be familiar with. So just to hear it said, is a nice fact to have in your mind, if that were the case. So we're wrapping up. I see one last question, which I would like to share to Director Sean before we close. And that question is from Sunil again, asking if you could speak about diet and eyes. Like, what's the correlation? Do you have any advice on nutrition as it connects to eye health for the viewers? If you could share something on that.
Yeah, when it comes to eye health, particularly towards children, since this segment is about children,
Yeah.
we want to tend to stick to the dark green leafy vegetables, the omega-3s, the colorful vegetables also, because they have a wide array of the necessary vitamins for the eyes. Um, Vitamin A is very good for the eye too, but we don't need to supplement with it because is we'll get the amount that we need from a healthy balanced diet. So is not, of course, you have to balance. You can't just eat fast food all the time. You have to mix in those vegetables, whether they like it or not. It's good to sneak it in, whether you do it as a puree in soups or whatnot. But you really want to try and get those things in.
Oh, so important. Thank you so much. Before we close, Dr. Bharath, do you have any closing comments before we end our session?
I just wanted to say a heartfelt thank you to the Trinidad Eye Hospital and the Trinidad Eye Hospital team, for for asking me, inviting me to come and collaborate with you all. I enjoy, the collaboration, and I think that this is a very good initiative in terms of patient education. So thanks so much, and thank you to my co-panelists as well.
Mhm. Oh, it was wonderful to have you on, Dr. Bharath, and also you, Sean. We really enjoyed this discussion this evening. So relevant. And, we have a part two sometime. I mean, even though we come out of Children's Eye Health Month, I think there's so much to discuss. And, children are our most prized possessions. Like, I don't mean to say possessions, but you know what I mean. Like, we
Yeah.
care about children in such a tender way. Anything we could do to prevent illness or discomfort, anything, it's always information that we want out there to help others and to make sure people are doing the best possible job they can as a parent. So thank you so much for joining, and thank you to our viewers for tuning in. We hope you enjoyed this discussion, and we certainly look forward to doing more discussions like this in the future. So have a good evening, everyone.
Okay.
Thank you.
Bye.
Okay,
Bye.
thanks. Bye bye.